It is now my privilege and pleasure to introduce our keynote speaker. Judy Belk is the president and CEO of the California Wellness Foundation. Prior to joining the foundation, she spent about 25 years working in the corporate and philanthropy sectors. She served as vice president of global affairs for Levi Strauss & Company and as senior vice president with Rockefeller Philanthropy Advisors. So I don't usually read verbatim from somebody's printed bio, but I absolutely love what Judy has written about what she does in her role as president of the foundation. She, quote, uses her vision and voice to level the playing field so everyone has access to healthcare, quality education, good jobs, healthy environments, and safe neighborhoods. She writes about these topics and more in a number of publications. You can find her work in the New York Times, the LA Times, the Wall Street Journal, NPR, and others. Judy graduated undergraduate from Northwestern University, and she earned her master's in public administration from Cal State East Bay. Please join me in welcoming Judy Belk.
Okay, do you both see and hear me?
We can now see and hear you. Welcome, Judy.
Okay, I'm here. Thank you, Allison.
Thank you.
Thank you so much for the invitation. I really wish I could be in the same space with you all. I was one of the ones who filled out the questionnaire saying, I'm really weary. I'm really tired of connecting with folks through Zoom. So I'm really delighted to be here. I also want to acknowledge the message from Congressman Ruda. We are so appreciative of all the work that he and others are doing for Californians in Washington. I was kind of thinking about what is it that I wanted to share with you. My head is spinning. I'm devastated to wake up this morning to see what's happening in Minneapolis with yet another African-American male tragically life was lost. Concerned about the safety of that community. The milestone of this week of us hitting 100,000 deaths lost by COVID, all of those things are on my mind. So I'm saying, what can I do to inspire myself and inspire so many of you who are working so hard during this difficult time? And I thought I would focus on two things that's on my mind a lot, and I think women a lot. It's really two roles that we play, both in the family and in the workplace. You know, as women, we've always worn multiple hats where we've played key roles. For me, I'm not well mentally if my family isn't well. And COVID-19 has put a lot of pressure on many of us in playing that family role. For parents, it can be a whole new world. I'm fortunate in that my children are young adults. They are thriving, they are healthy and safe, but they're in Washington, D.C. We Zoom regularly, but I really don't know when I am going to see my children again. And that's really painful. I know that I see many of my coworkers, my colleague Wendy is saying, I don't know how to do fourth grade math. She's doing her job here at Cal Wellness, and she's teaching her son Jaden math. That is the role that many of us are finding ourselves in. There are many folks that are grieving about milestones of graduations and weddings. And for many mothers with young children, many childcare options have disappeared. And many have relied on grandparents as childcare providers, but they're not able to leverage that during this time because we want to keep our grandparents safe. And then many of us are caregivers for our parents or other elders in our families. My aunt Mopsy, who lives in Virginia, she is safe. She's the matriarch of the Belk Casey family, and she's fortunate enough to live in her own home. But we have seen the statistics of how COVID-19 has devastated care facilities. Residents in these facilities represent as much as 40% of deaths, and women are often the caregiver of their parents. And then in the workplace, COVID-19 has changed the lives of women. We've always had to do double shifts, but that's more evident than ever. Many women who are primary income earners for their households are out of work. Economic stress, and because in this country we still link job with healthcare. Not only are many families and women dealing with loss of income, they're also worrying about healthcare for themselves and for their families. Women are also, as the congressman talked about, we are disproportionately represented among the essential workforce, health professions. It's women who disproportionately are bagging our groceries, fulfilling online purchase orders, providing food for our tables through working at meat processing facilities or working as farm workers, all who are putting their lives in jeopardy. And I think that when I think of work, I also think of the work that I'm trying to do. And we at Cal Wellness, we are really privileged. We have a job. Um, we're all working to get resources out to the community. So I want to just talk a little bit about what we have really tried to do in supporting communities and families during this time. Over the last few weeks, we've pushed out about $5 million in emergency rapid response dollars all across the state, including supporting the Rapid Response Fund in Orange County. And I swear, I think 5 million is a lot, but I feel like it's not enough from what we're hearing. We're also trying to use our voice to share accurate information about how to stay safe. We are sending letters and joining with others and really talking about the racial disparities. And we're using our voice in holding government accountable. I believe that the philanthropic community has really responded across California with significant resources, but the dollars that the philanthropic resources have, even if you pulled them all together, are small compared to the trillions of dollars that government has. So we want to be sure that those dollars are getting to the communities that really need it. There are three other areas that I want to talk about. These are issues that Cal Wellness has been focusing on even before COVID, but they've really risen to both our concern and to our focus during this time: place, race, and immigration status. Let's talk a little bit about place. While many of us have been called to shelter at home, and we're fortunate enough to have homes, it's important to acknowledge that for many women, home is not always a safe place. Gun violence prevention, which has been a major part of the legacy of this foundation, has really been a priority, and we've been alarmed by the skyrocketing number of gun sales in recent months. This state has seen about a 72% increase in background checks for gun purchases in March. Um, Calls to domestic violence hotlines have risen in many communities. So violence is a huge issue, and we know that a lot of violence um, happens in the home. And we're concerned about that, and are continuing to look at ways to support communities and families during this time. You know, where you live is important in this state. There's a huge difference between living in Beverly Hills and living in East Los Angeles. Um, and we're particularly concerned about what happens at the county level, because in this state, the county that you live in can play a huge role if you are a woman or a family needing health care. In Orange County, there's progress that's been made when it's come to expanding access to care, thanks to the work of the Women's Health Project and to other organizations such as the Coalition of the Orange County Community Health Centers, led by our Cal Wellness board member, Isabel Pacera. But there is more to be done to build a robust safety net. Orange County is an important place of our focus. We fund many terrific organizations working on health equity, and more needs to be done, and that's been apparent even before COVID. Race. Allison shared the alarming statistics about the impact of COVID on race. It's been a heavy impact on Black and Brown communities. And these aren't just statistics. I lost my first cousin, Dino, to COVID-19. He put his life at risk to to make money as an essential worker, and he died in an Alexandria hospital in my hometown. Um, I've written about this issue, and many of us know that even before COVID, um, unfortunately, there's a huge gap in this country between life expectancy depending on your race. The other issue is just the lack of underinvestment in places. And places like South LA and Santa Ana are really struggling as a result of years of underinvestment. And that's playing out as we look at the impact of unemployment and the economy during COVID. Um, we've tried to take some responsibility here in philanthropy. We're leveraging our endowment to get capital into underinvested communities, and we're going to increase that during the next year and a half, where we're really hoping focusing on getting America and California back to work, but through program related investments and loans, we hope to provide additional resources. Immigration status. Cal Wellness is firm on this. We believe that access to health care is a human right. Unfortunately, we're in a situation where in many parts of even the state, your immigration status impacts whether or not you have access to health care. This is a huge issue for us. It's a huge issue for women. California is home to almost 11 million immigrants. Of those, about 23% are undocumented. I am proud that our state has taken some action to provide cash assistance during this time to undocumented immigrants, but that's not enough. The fact that the federal government continues to block access based on immigration status is unconscionable during this time. Okay, so there's a lot that I've thrown at you, and you could want to say, I just want to go back to bed, Belk. But what can we do? I think each of us, we need to be intentional in how we engage in recovering and rebuilding in the post-COVID world. Think about the hats that we all wear, the tables where we sit, the anger that we have. Sometimes anger, if channeled in a positive way, can spur action. Anger can sometimes be good. We need to be angry about injustice that is so apparent during the COVID pandemic. We need to hold government accountable. We can't just rebuild the same systems that have left so many women in California vulnerable. We need more resources. Starting with, you can vote, not just determine who lives in the White House. It matters who serves on the Orange County Board of Supervisors, local school boards, and who represents us in Sacramento. We can champion the importance of investing in women's health in the state and in the national level. We're concerned about the recent budget revision that we've seen at the state level, reducing funding for many programs that women depend on. We're looking to our advocacy partners like the Orange County Women's Health Project for help. We need them more than ever. And at the national level, as the congressman said, women's reproductive rights are under threat. This is not a joke, in ways we haven't seen in decades, at risk because of the current administration policies, including changes in Title X and the potential reversal of Roe versus Wade. I can also tell you that Cal Wellness will stand with you on these issues. Together, we need to rethink what the safety net should look like. Maybe we can finally have a conversation in this country about delinking jobs and health care like the rest of the world seems to address. We need to maintain a focus on reducing income equality, a key social determinant of health, and we need to keep a focus on race and place central to our work. We at Cal Wellness, we're going to use all of our tools, not just our grant making, our voice, our investment dollars to support communities across California. I, again, want to just end by saying I really wish that we were all together. The line up of the speakers and the panelists are unbelievable. And I know they're going to address a number of issues that we care deeply about trauma, ACEs. And in closing, I just want to say self-care is my most important message that I want to leave you with. For you and your families, for your workplace, many of you are on the front lines working in clinics or healthcare facilities or at nonprofits that are providing critical services under the most challenging conditions. While I hope this crisis will pass soon, this is a marathon, not a sprint. We're going to need your leadership. We're going to need your vision. And at times we're going to need your anger for the rebuilding that's to come. I hope that we'll have some time to engage in conversations. And Allison, I want to turn it back over to you and thank you again for inviting me.
Wow. Judy, I have to agree. I so wish that we were in person together right now, because I'm quite confident that the room would be full and people would be on their feet, standing and giving you a full standing ovation. I cannot agree with you more about calling out the inequities that have been exposed during this crisis and the importance of rectifying those inequities in the rebuilding from this crisis. And I'm thrilled to hear that the California Wellness Foundation has been so proactive in pushing funds out to support the crisis response, and already looking forward to not only funding, but informing what the recovery should look like so that we can achieve more effective, efficient, and equitable systems of care. I would like to ask if you could take a moment just to share some thoughts on how the $5 million has been deployed. Have you noticed any particular trends? I know locally in Orange County, our Orange County Community Resilience Fund has focused pretty heavily on basic needs delivery, food, shelter, and healthcare. And our United Way Pandemic Fund has been supportive of housing and the basic needs of individuals and families. So we are so grateful for your support and for the leadership of all the foundations and funders that have contributed, as well as individual donors, to these two countywide funds. What are you seeing from the California Wellness Foundation's perspective?
Sure. Well, the one thing that I love about Cal Wellness, which is just part of our tradition before I even joined, is that we're what's called a responsive grant maker, which means that we really take our cues from what's happening in the community. So as soon as the COVID response happened, our programs team got on the phone and just reached out to our community partners and saying, what's happening, what's going on, what can we do? And not surprisingly, they said, get us some immediate rapid response grants as soon as possible. We're just needing resources. The other group that we really touch bases with are our community foundation partners in Orange County and around the state. The one thing that you realize in a situation like this is a big state. And the needs that are in Orange County might be very different regarding what the needs are in Imperial Valley. We are a statewide funder, so we really thought, all right, how can we respond? So the first thing we did is that we immediately just started sending out rapid response grants to all of as many of our key grantees as we could. We sent rapid response grants to all of the regional associations of community clinics, such as the one Isabel leads in Orange County, because they were at the front line of the effort. But we also relied on our community foundations, who immediately put together rapid response funds. And we really felt that community foundations, of which California is really so fortunate, and Shelley's work in Orange County is a great example too. They are really close. We felt getting dollars to them that they could then funnel immediately to food banks, to domestic violence shelters, to deal with the homeless issues. So those dollars got out fairly quickly, and we really felt that with the support of these regional emergency funds, and with our own rapid response, where we got out about $5 million, I just looked at the stats that we really did touch every corner of the state. But as I said, to me, that's pennies. We really then decided to work with other funders and using our voice and really saying, we funded a lot of advocacy organizations that are putting pressure on Washington that as these trillions of dollars are coming down, are they hitting? And I would say the first wave didn't quite hit the communities that we wanted to be hit. A lot of businesses of color and other depressed communities were not getting those dollars. So we also kind of reached in with that, and we're continuing to work. We also, began to make a few program-related investments and loans, and we've just continued to talk and talk. And it was really the community who were the first who hinted, "Hey, this is hitting several communities disproportionately." When we were talking to our folks in South LA, they were the folks who saying we're seeing a disproportionate hit on communities of color.
Thank you. You mentioned that you were funding advocacy organizations, and actually this touches on some of the questions that are coming in from the audience. So Sora Tanjasiri asks, what do you see as some of the major policy opportunities that can address both COVID-19 and health equity, including justice?
Well, I've been thinking a lot about that because I really mean it. If we go through all of this, if all of these lives have been lost, and we come out at the other end with the same broken systems, I think I'll just go nuts. So this is what's on my list. Number one, can we really begin to have a serious conversation about universal health care? Really, my friends in Europe have thought even before COVID that we were nuts in this country, where the best shot you have of having health care is to have a job. And they're saying, well, what does having a job and having health care? So if you don't have a job, you don't have health care. Well, here we are, right? So that's an issue. Income inequality. Can we really begin to really look at income equality? Believe me, I hate that anyone is on unemployment, but and your folks know that income inequality has been an issue for a significant part of women and folks in this state for many years. And so maybe there could be a little compassion for those who have found themselves standing in food lines and counting on government to provide support, that when they find themselves back at a job, that maybe they might have more compassion to look. So that's an issue. The issue about race, we've talked about that. The fact that there's almost, an 11 years life expectancy difference between a Black male and whites is crazy. So maybe we can look at that. I think we don't need to look at the issue of equality around digital divide. The most painful story I heard was amazing honor roll students across the country trying to do their homework on their cell phone. And so I could go on, but those are a few. And then I think really a new social compact with government. Do we really need to have an argument about whether or not we should look at government and helping to provide a safety net? Maybe there'll be more compassion when so many folks who never thought they would ever have to look to government for support can understand why that has been a norm for so many in this country.
Thank you. I do think that is one of the challenges, certainly, but also potential silver linings, is that so many people who have never had to navigate a public benefit or a public program are going to learn just how difficult that can be, especially when our infrastructure is already being so overtaxed. So thank you for calling out some of these policy opportunities. We have time for one more question. and I would ask if, from Felicity Figueroa, has there been any funding specifically from Cal Wellness for the undocumented community? Do you know whether any of your emergency crisis response funds have supported?
Sure. We're really quite proud, even before COVID. I took this job in 2014. I thought, this is so exciting. The Affordable Care Act, Obama's in office, and we decided at that point that we were going to really focus on those who were left behind. So even the Affordable Care Act left behind, in our mind, on the undocumented community. So we were always zeroing in our effort on that. We have a report just came out by a watchdog group of the philanthropic organization, the National Center on Responsive Philanthropy, and they ranked California Wellness Foundation as one of the leading funders in California for immigrant and refugee support. And we have, I know that there are many other foundation partners across the state that join us, but we are zeroing in on that. We don't think that because you live in LA County, you have access as an undocumented to healthcare, and places such as Orange County and others that you don't. We believe it's a human right, and the fact of your immigration status shouldn't matter one bit.
Well, thank you so much for your incredibly inspiring remarks, your insightful exploration of how this pandemic is affecting women's health and communities of color and those members of our community who have been left behind historically. This has been an unbelievable way to kick off the series. Thank you so much, Judy, for your time and your expertise. And we look forward to your continued partnership in Orange County.
And Allison, thank you so much. And again, I want to just provide gratitude to you, to your leadership, and those of you in the audience. Please, we want to hear from you. Send me a note. Follow us on Twitter. We'd love to hear your thoughts. And I know you're going to have just an amazing summit. So thanks for letting me kick it off.
Thank you. I also want to thank you for sharing your personal story and how you've been affected by this pandemic, and to acknowledge that we did reach this very devastating milestone of over 100,000 deaths this week as a country. We are all mourning, and I think we should all heed your call to action to make sure that we parlay our anger and our sadness into action. And on the note that you just mentioned that the foundation would like to hear from everyone in the audience, I'd also like to echo that and say we are just as interested. And in the evaluation survey, which I'm going to plug throughout the morning, we actually have added a few questions. You'll recognize most of them from past summits, but we would really appreciate your comments and suggestions on what else we can be doing and what else you'd like to be hearing and talking about after the summit with regard to COVID-19, and especially looking forward towards the rebuilding. We have to inform the process in Orange County and beyond. How do we overcome some of the structural barriers and the institutionalized disparities as we have this once-in-a-lifetime opportunity to rebuild our systems of care in Orange County? So please do take time and share your thoughts with us, and also send them to the California Wellness Foundation. So thank you, Judy.
Thank you so much.